So we've talked about what a cataract is, the fact that yes, you have them and you're ready to have them removed. We've also discussed different lens options and decided how do you want to see after surgery, being more dependent or less dependent on your glasses. Now let's talk about the surgery day itself. I know that surgery can bring anxiety for people, and that's normal. I tell people they'd be abnormal if they weren't a little anxious. But I also want to let you know that actually it can be a super fun and very enjoyable experience, not just for me, but for you too. So when you come to our office, what is one of the great things about our office is that you're coming back to one of the same rooms that you had your preoperative evaluation in. You might have had some of your testing done, so you're in the same exact spot with the same exact people. We find that that's really comforting for our patients and definitely does relieve their anxiety. We get you dilated in that room, and you'll wear a little gown and some fun little shoes. And then I'll come in. I always put a mark on which eye we're going to, above your brow, which eye that we're going to do that day. And if it's a fun, day, I'll get a fun little drawing for you. But let's talk about the surgery itself. The whole process of coming in and leaving usually takes about an hour. The surgery takes about 10 minutes. And getting you ready for that takes some of the time. And in that 10 minutes, what are you going to experience? We'll bring you back to the operating room or the procedure room, get you all comfied and laid down. My team will get the eye prepped, make sure everything's nice and sterile and draped. And then when I come in, I usually bring my microscopes over you, and they're bright. I've got 2 really bright lights, and I always say, yes, I really want you to look at them. But good news, they get less bright very, very quickly. The other thing to note is that we use a lot of fluids throughout the case, a lot of cold and wet. So my team and I are constantly like, Jane, it's cold and wet. Jane, cold and wet, cold and wet, cold and wet. You'll get tired of that, but you'll probably remember it. Next, for good and bad, you don't get to see anything that I do. So your view, you might see some shapes, some forms, but you're not seeing anything that's actually being done. So that should also relieve some of your worries or anxieties. You might have a great light show with lots of different multicolored lights, so enjoy it if you get a good light show. Lastly, you may or may not have some mild pressure from time to time throughout the case. I will be talking with you throughout the whole entire case, warning you if you might feel something like that, but just because I say that you may feel something, also you may not.